Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Dr. Kaylin Edwards of Novant Health Pediatrics Brunswick, and then we'll meet Dr. Ryan Jordan-Hazy, the Emergency Department Medical Director at Novant Health Brunswick Medical Center. Finally, we'll learn more about a brand new service at Novant Health, cardiac calcium scoring. So stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Dr. Kaylin Edwards of Novant Health Pediatrics Brunswick. Dr. Edwards, it's so nice to have you here. I'm so excited to meet you.
Thank you.
We're really excited about the opening of your new practice. It's called Novant Health Pediatrics Brunswick, right?
That's correct.
So we're real excited to have that as part of our family, and great to have you in the area. How are you enjoying the area?
It's wonderful. We've been very happy being here so far.
Yeah, it's really a great place to live, and it's kind of like being on vacation every weekend,
Yes.
you know? So let's start by learning about you. So tell me about your background and your education.
So I grew up outside of Raleigh, and then I went to Meredith College for my undergraduate degree. Then I went to the Brody School of Medicine at East Carolina for medical school.
Awesome school.
Yes. And then I stayed there for residency.
Nice.
I did a combined residency in internal medicine and pediatrics,
Nice.
so I can take care of both adult and pediatric patients.
That's awesome.
Yeah.
Well, what interested you in pediatrics?
So I love the resiliency and the optimism that children have. No matter how sick they are or what you tell them, they just still have belief in the world, and they're just very resilient. And I think that's a wonderful population to work with. They make me want to be a better person and to work harder to keep them healthy. And I think that's really what drives me to take care of them.
Yeah, that's an awesome philosophy.
Yeah.
Well, how about relocating to Brunswick County? Did you always want to move here, or how did that happen?
So my family is from Whiteville, and so...
Oh, you're a local girl.
Yes. So when I wasn't in school and had to be in the Triangle, I was usually down here. My grandparents live out on a farm in Columbus County, and
Nice.
I spent all my summers there,
Sure.
all the holidays. Anytime I could be away, that's where they would find me.
That's awesome. I always wanted to live on a farm.
Yes. So it was an easy decision. It was like coming home.
Yeah, really.
Yeah.
So tell me more about Novant Health Pediatrics Brunswick. So where are you located?
So we are in Brunswick Medical Park off of Highway 17.
Yeah, easy to get to.
Yeah.
Lots of parking.
Yes.
Great building. Yeah. And you have another pediatrician with you, correct?
Yes, Dr. Tackman. She is a pediatrician who is coming to us from a practice in the Triangle. She has many years of experience, so I look forward to having her with us.
Awesome. Yeah, that'll be great. You guys are going to be really busy.
Yes.
So what kind of services does your office provide?
So we provide comprehensive health care for children. So everything from newborn well visits to well child exams every year, sports physicals. We also do follow-ups for asthma, eczema care, and of course sick visits for anything that parents are concerned about.
Pretty much anything that a child can get, you're going to take care of them.
That's right.
And well, too. So tell me about ages. Will you visit the hospital right after birth, or how does that work?
Yes, so we see everyone from the day they're born
so
until 18. Yes, and so we'll be in the hospital every day to see the newborns and their families.
And then they age out at 18.
Yes, and we help transition them to adult care.
Perfect.
Yeah.
Perfect. That's great with the newborns, because you start that relationship from day one, and that's going to be so comforting to moms.
Yes.
So we're real happy that we have this new practice with us. We're heading into fall now, and of course that brings flus and colds and what have you. Do you have any tips for parents how to avoid those types of illnesses?
So
wash your hands, right?
Right. Wash your hands. Hand sanitizer does work. So if you can't get a child to wash their hands, hand sanitizer helps as well. Things that we commonly think of, if they cough, having a tissue if you can. If not, teaching them to blow their nose in their elbow versus their hands, because they're touching everything. Also, not allowing kids to share cups, so not letting them share sippy cups without sterilizing them.
Certainly not toothbrushes.
Right. Yuck.
I know kids who want to do that.
They do. Yes. So things like that, and protecting against the flu vaccine is the biggest thing there.
Yeah. How do you know when to call the doctor?
So any child that's less than 3 months old, if they have a fever, should absolutely be seen by their pediatrician. And a fever is anything over 100.4. In older children, honestly, if you're worried, then call the pediatrician. Every child is going to get about 6 colds in a year.
Yuck.
So they're normal. So your child's not broken. But it's good to know the things that are normal in a cold. And so they can typically run a fever for 2 to 3 days. If it goes over 3 days, we probably need to see them. They can have the sniffles and the runny nose for really about 2 weeks.
Wow.
But if it gets to anything you're concerned about, then give us a call. And then the cough is the most aggravating thing to everyone.
It lasts forever.
They do, and so they can actually last about 3 weeks. But if it gets to be a cough that just won't go away, just call us and we'll be happy to see them.
Let's see. How about home treatments? Is there anything you can do specifically at home to treat like colds and stuff?
So the big thing is helping them get all the gunk out of their nose.
Yes.
And so the average child really can't blow their nose until they're about 2 to 3 years old. So when they're less than that, sometimes using nasal saline, putting a few drops in their nose, and then either using the bulb suction or trying to encourage them to blow as hard as they can. And then as they get older, still using the nasal saline, blowing their nose, but also remembering to put something to help protect their skin. So some Vaseline around there, so it's not getting so raw.
Yeah, the noses get kind of sore.
Yes.
Well, you mentioned flu shots briefly. I'd like to spend some time on that. How important is it to inoculate your child against the flu?
So the flu vaccine is honestly the best way we have at preventing children and adults from getting the flu. And a lot of parents come to me and say, well, my child got the flu and they got the flu vaccine. And so the flu vaccine is not going to guarantee that you won't get the flu, but we know that children who have the flu vaccine are much less likely to be hospitalized. And that is very important.
And I understand there's 2 types of flu vaccines and nasal and all that. Talk a little bit about the different types.
So there is the flu mist, which is the nasal vaccine, and then there is the vaccine that's just like a shot. So in the past 2 years, the CDC has recommended against the flu mist because it wasn't shown to protect against the strains that were predicted. Actually, this year, the CDC and the American Academy of Pediatrics have said that we will be able to use the flu mist. So the flu mist is an option for any child over 2 years old who does not have a history of asthma or any respiratory disorder.
So why do you think the CDC approved the mist this year as opposed to the years past?
So this year, and everything they've studied so far, the mist appears to cover the strains that they think will be in the flu this year. Every year is a prediction, so that's why some years are better than others. But this year, the mist has shown to be good coverage, so we'll see.
That's good. yes, some kids don't like to get shots, so
Right.
that is an option for them.
Right.
Yeah.
Yes.
Well, I know you're taking new patients,
Yes.
and you do have sick visits as opposed to well visits.
Right.
And but how about walk-in hours? You need an appointment, correct?
As of right now, you do need an appointment. We may have some walk-in time, so just stay tuned.
Okay. And how might they contact you? They can do it through MyChart, or they can call your office for an appointment?
Right. So we're on our website, Novant Health Brunswick Pediatrics, and also they can call us anytime to get an appointment.
Okay, and we'll run that number on the screen
Okay.
for our viewers so they can make note of that. And we'll probably have magnets or something at some
Yes.
point, right?
Of course.
Right. All right, well, Dr. Edwards, thank you so much for being here today. It's been a pleasure to have you. And I can't wait to meet your partner.
Yes, thank you for having me.
You're quite welcome. Now, let's welcome Dr. Ryan Jordan-Hazy, the Emergency Department Medical Director at Novant Health Brunswick Medical Center. Dr. Jordan-Hazy, it's such a pleasure to have you here today. I'm really excited to learn about you, and I know our viewers out there will be very interested. So let's start with your background. Tell me a little bit about yourself.
Yeah, sure, no problem. I'm excited to be here as well. Thank you, June.
Great.
Basically, my name is Ryan Jordan-Hazy. I'm an ER doctor, the medical director at Brunswick Medical Center ER. I'm born and raised in Pittsburgh, Pennsylvania, which is where I grew up, went to high school and undergrad. I went to medical school at Wake Forest University in Winston-Salem.
Well, that's neat.
Which at the time is where I met my wife, or my future wife, I should say. We ultimately have been living in Winston-Salem for the past few years. We had a baby boy about 10 months ago named Palmer. And just a few months ago, we moved to Wilmington when I got this job here at Brunswick.
Yeah, how are you liking Wilmington?
It's nice. We love it. We have some family in the area, which makes things
great.
great. And we'd already been here a handful of times to visit, so we figured, why not live where you vacation?
That's neat.
Yeah.
And Palmer, what a cute name.
Yeah, he's something special.
Well, that's great. We're happy to have you here. Tell me, what brought you to ER medicine? What interested you in that?
Yeah, it's always a tough question to answer. Growing up, I always had a bit of interest in it. My mom was an ER nurse, so I got exposed to it when I was really young, and then sort of growing up, I knew I wanted to be a doctor.
Sure.
So I spent some time in the ER. I volunteered in high school, worked as a tech when I was in college.
Really?
Yeah, and then through medical school, you sort of rotate through everything.
Yeah.
And it just seemed like a good fit. I like the pace, I like the...
It's a fast one, huh?
Yeah, the variety. The hours are pretty good usually. And
Even at night?
Yeah. Well, sometimes at night you see the more exciting and more crazy things.
Well,
so
that's true.
yeah, so overall it seemed like a good fit, and I'm really glad I picked it because
That's
it's led me here.
Yeah. Well, you mentioned that you're the medical director at the Novant Health Brunswick Medical Center Emergency Department. Tell me what that entails.
Yeah,
as
I mean,
medical director.
Yeah, sure. The vast majority of my time is still just clinical, just like anyone else that works there. I spend my time working my shifts, seeing the patients that come in.
Okay.
And then on the medical director side, it comes with, as you might guess, some more administrative roles. I deal with scheduling, recruiting. I meet with the hospital administration to make sure that everything is running smoothly. We work through improvement protocols and processes to make sure our throughput is meeting benchmarks, make sure all the national benchmarks in terms of stroke care, heart attack care, sepsis care are being met, and figuring out ways to improve on that end.
And do you find yourself having to have discussions with families if there's a problem or they're not?
Yeah, that's a big part of the job too, is dealing with the patient grievances or complaints.
I'm sure you don't have too many of those.
No,
But
we actually do really great at Brunswick, but anyone that has any sort of issues or concerns, that'll come to me and I'll make sure that we address them.
Well, that's awesome. So other than yourself, how many providers are there in the emergency department at Brunswick?
So we have a good core of 10 providers, 5 full-time docs and 5 full-time PAs and NPs, APCs, if you will, yeah. And then a handful of part-timers and PRN people that live in the area. We're now luckily at the point where we don't have any travel docs or travel PAs. They're all sort of members of the community.
So the 5 physicians that you currently have, they live in the community or in the surrounding community?
Yeah, I mean, a lot of them are born and raised, Southport,
nice.
Shallow, Wilmington, things like that.
Dr. Sherrod,
yeah,
we've
exactly.
had him on our show quite a few times, and I know he grew up in Southport.
Yeah, he's a really well-established. Everyone knows
everybody
him,
knows
so
Bill.
he's a great asset to the team.
Well, let's talk a little bit about what it takes to be a physician in the emergency department. Tell me about like their experiences or their credentials.
Right. One good thing and one really nice sort of service that we offer is that all of our physicians are board certified in emergency medicine.
And that's very important,
Yeah,
isn't
definitely. Because, well, depending which ER, not every ER you go to will have a board certified physician, and ours 24/7 we'll have a board certified physician there waiting, ready to handle anything. So they've been trained specifically in emergency medicine.
Yeah, that's very important because I have been in emergency departments in the past, well, not here, and the physicians were not emergency trained physicians.
Right.
They were just locum tenens or another service.
Yeah, some places have to make do with what they
Sure.
with what they can, but us, we luckily don't have that problem. We have all board certified.
That's great. Yeah. Well, I know the name of your group is Apollo MD, correct?
Correct.
And so tell us a little bit about the relationship you have with Novant Health.
Okay. Yeah, Apollo MD is basically a nationwide medical company, medical staffing company that provides staffing services basically to hospitals nationwide. Recently, they have come into a partnership with Novant Health, mainly on the ER side. So they have a deal with Novant to provide ER coverage for 4 hospitals in the area, or in the state, I should say. Kernersville and Clemens, which is out by Winston-Salem, Thomasville ER, and then also Brunswick here. And that relationship started earlier this year.
So you say it's nationwide, so it's all over the United States, Apollo MD?
Yeah, pretty much. I mean,
Really?
I think it's centered mainly around the Southeast, Georgia, North Carolina, but they are staffing over 100 hospitals nationwide.
Wow, that's a lot.
Yeah, it's a pretty big company.
Yeah. So it sounds like there's a lot of experience within Apollo MD. I mean, there's a lot of physicians who've done this for years.
Yeah, I mean, it's a physician-owned, physician-led company, and it's been
Nice.
around for over 30 years.
Oh, that's great.
And one nice thing is, even the president of the hospital, president of the company, sorry, or CEO of the company, they're physicians, and they work in the ER just like everyone else.
Wow. You said in addition to being the medical director, you staff too. You are a physician, a working physician in that.
Which is nice for Apollo because the same thing can be said for the highest up CEO or president. They're also working in the ER, so they know what it's like. In fact, Dr. Patan and Dr. Patel, which is the president and regional director of the company, they've all worked shifts here at Brunswick, and they have nothing but good things to say about it.
So the bosses work too.
Yeah, exactly.
Right. Well, I know that we recently entered into a partnership with New Hanover Regional Medical Center to provide AirLink services to us through the AirLink company. Some of our viewers may not know about that. Let's talk a little bit about that service.
Okay, sure. Yeah, AirLink basically, to break it down simply, is a helicopter service that transports patients to where they need to be. So we actually have a helicopter based at Brunswick Hospital ER, where if there's anything emergent or life-threatening, that time is of essence and they need to get somewhere to basically save their life, we don't have to have them ride in an ambulance, which obviously can be multiple delays depending on the time and situation. We have the luxury of having that helicopter there to transport. And right now there's available, I guess you could say, 12 hours a day, with plans here in the near future to have it 24/7, which will be a good sort of service for the community.
I understand they're going to extend those hours.
Yeah, certain things. I mean, you might imagine like if you're having a major heart attack or some catastrophic illness or injury that you need to get somewhere fast. You don't want to have to wait around for transportation.
And I believe that they often will go to the scene of an accident or what have you and pick that patient up.
Yeah. So sometimes they'll bypass us. If they get called to a bad car accident or something, they land the helicopter in the field and just take them and go.
Yeah. I know that sometimes people can't decide whether to go to the emergency department or a critical access or urgent
something,
care
yeah.
or something like that, when do you recommend you come straight to the emergency room?
Yeah, that's always
That's
sort of a
one,
tough
isn't it?
question
Yeah.
because we don't want to ever, so we see everyone, anyone who shows up, we're glad to
Sure.
see you. Sometimes you might be better off, sir, for your personal financial reasons to go to an urgent care.
But if in doubt, you probably
Anytime
should
in
come to
doubt,
the-
and anything, you know,
Yeah.
chest pain or
Right.
shortness of breath or any major injury, if you show up to an urgent care, they're probably going to send you our way anyway.
True. Yeah.
So if you're ever
Great.
sort of on the fence, I would say definitely err towards the side of coming to the ER.
Well, great. Well, it's been a pleasure to have you on the show.
Uh-huh.
And what a great addition to Novant Health
Yeah,
Brunswick
I'm happy
Medical
to-
Center.
happy
We're
to be
happy to
here.
have you here. And
Yeah.
we hope to have you back real soon, and we'll see how things are going.
Yeah,
I
no
heard there's a
problem.
lot of new things going on at Brunswick.
Yeah,
so
we're really excited about the opportunities to expand and continue to serve the community.
wonderful.
Yeah, thanks
well,
so
thank
much.
you again for being here.
Yeah, thank you.
Finally, let's welcome Robin Ashmore and Chelsea King of Novant Health Imaging Services. Robin, Chelsea, it's such a pleasure to have you guys here today.
Thank you for having us.
Thank you.
You're quite welcome. Let's start by sharing your roles at the hospital. So we're going to start with you, Robin. What is your role at Novant Health Brunswick Medical Center?
I'm the manager of the imaging department, and that includes our outpatient facility down in Carolina Shores.
Big job.
Yes, very big job.
How about you, Chelsea? What do you do at Novant Health?
I am a CT technologist in the imaging department at the hospital.
That's awesome.
Yes, ma'am.
Great. So let's talk a little bit about how you became the director of the imaging and how you became a technologist at Novant Health.
Well, I started out as a technologist back in the early 90s and have
Interesting.
been doing it for a long time. I've been with Novant for 18 years and just gradually moved into the management position.
Awesome. How about you, Chelsea?
What led me to Novant?
Yeah.
I started out, I graduated from Robinson Community College in Lumberton, North Carolina. I pursued and earned my associate's degree in radiography there. My initial job right out of school required me to be a multimodality tech, which required me to do x-ray and CT. So therefore, I cross-trained, self-studied, and I got my certification in CT. I've been doing this about 6 years. Luckily, this led me to Novant. It's a great opportunity.
Great.
And I've been with Novant going on about a year now. I can't believe it's went by so
Awesome.
fast.
Oh,
Yes,
that's great.
yes, ma'am.
That's great. So I know today we're here to learn about cardiac calcium scoring, correct?
Yes.
Which is something new to Novant Health Brunswick Medical Center. So tell me what calcium scoring is.
So for many people that don't know, plaque inside your arteries of your heart can build up and grow and restrict blood flow to the arteries of the muscles of your heart. A cardiac calcium score, it reflects the total area of calcium deposits and the total density of the calcium within the arteries of your heart. So when you have a cardiac CT that measures the calcium, this allows your doctor to verify and give you the possibility if you're having coronary artery disease before signs and symptoms occur.
And it could be a lifesaver.
Yes, absolutely. Yes, ma'am.
Yeah. So how do you perform this test? What do they do?
When the test is performed, we place painless sensors called electrodes on the patient's chest area. This connects to a EKG, also known as an electrocardiogram, which allows us to monitor your heart activity during the procedure. During the exam, the patient lies on a movable table that slides in and out a CT scanner. No worries, your head stays out the entire time. I know
good.
people
That's good to know.
have a common fear of that, but the scanner's open, your head stays out. Once the scanner procedure begins, we ask you to lie still, give you some breathing instructions while we take images. The CT technologist, like myself, does perform and run and operate the scanner in a room behind the patient.
Right.
However, there's an open window, we can see you and we can talk to you the entire time.
Great. Well, sounds painless and very quick.
Yes, ma'am, absolutely.
So Does the scoring need a physician's referral?
It does require a doctor's order. It doesn't have to be a cardiologist.
Okay.
It can be your primary care
So
physician.
any primary care can order calcium
Yes.
scoring. Awesome. So then the physician would receive the results, correct?
The radiologist will read the exam once the procedure is done, and then it'll go to the doctor.
Okay, the doctor who ordered
That
it.
is correct, yes, ma'am.
Okay. So I understand that this particular test is not covered by most insurances. So Robin, we're going to give you a chance to talk. Tell me about that.
That is correct. Most insurance companies do not cover this.
Not even Medicare.
Not even Medicare. So what we've done is we're offering a special self-pay rate for everybody because the insurance companies don't cover it, and that rate is $99. That includes the exam and the interpretation.
I believe that's less than any other facility around offers them for.
Yes.
That's great, because I understand this can be a lifesaver.
Yes, it can.
Oh. So if somebody's watching and they think that, they've had some heart issues and currently see a cardiologist, should they just talk to their doctor about it?
Yes, they should absolutely talk to their cardiologist if they're having any type of issues and can actually request that they order this exam.
Awesome. So once they're scheduled, are there any special instructions that the patient needs prior to the exam, Chelsea?
There's no particular special preparations needed.
Okay.
The patient can take their usual medications as normal. We would suggest you not drinking and avoiding caffeine for at least 4 hours, and if you're a smoker, try not to smoke 4 hours before the test.
Well, that's not too bad.
No, ma'am, not at
Yeah.
all.
Well, that's really great information, and I'm glad we were able to share that today. I know that somebody in my family has recently had that and discovered quite a few blockages and are about to have cardiothoracic surgery.
Wow.
And so I understand from a personal perspective how valuable this information can be, and
Absolutely.
I would recommend it highly.
Yes.
So, Robin, I know there's lots of other things going on in the radiology department. Let's talk a few minutes about that.
Okay. Well, we're a full modality
Right.
radiology department. We offer everything. We have X-ray, we have MRI, CT, nuclear medicine, ultrasound, bone density, and mammography. We just installed our second 3D mammography unit.
That's awesome.
Yes, it is. So we are seeing close to 60 women a day doing mammograms.
Wow. And you still have the mobile unit, right?
Yes, we do have the mobile coach. It is out in the community 3 days a week, and then we take it to special events when they're offered.
That's pretty cool. And we do offer charity care for those on the mobile unit. We do take it places and do it for free.
That is correct. We have received a grant from the Komen Foundation, and we offer that for women who can't afford to have their mammograms because we believe it's very important.
Yeah, absolutely. How about the area in Carolina Shores? Do you not provide imaging services at Carolina Shores?
We do. We have an outpatient imaging facility down in Carolina Shores. We have X-ray and ultrasound there 5 days a week. We have MRI there on Wednesdays, and then generally 1 day a week the mobile mammography unit is there.
Good. Well, that is great information. And Chelsea, once again, it's best to discuss it with your primary care or your cardiologist, correct?
Yes, ma'am, that's correct. To see if you're a good candidate for the test, because there's many variables that will be suitable to see if you're for the test.
Sure,
Yeah.
great. Well, thank you so much for this life-saving information,
Yes, ma'am.
and for information about all the other services at Novant Health Brunswick Medical Center Imaging Department. I hope you guys will come back and tell us how it's going.
Yes, ma'am.
Yes,
we
thank
will.
you.
Thank you.
Well, thanks again for being here.
Absolutely. Thank you.
Thank you.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novanthealth.org for more information on Novant Health Brunswick Medical Center, our local doctors, and general health information. Thanks again for joining us today, and be sure to join us next time for Health Watch on ATMC TV.
ATMC TV, your community channel.